Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Did you know that there are a lot of holistic ways to treat fibromyalgia? Fibromyalgia is a very challenging condition. It's challenging because it's both uh, difficult to diagnose and also to treat, since there are different clinical signs and symptoms unique to each patient's case. So therefore, diagnosis is made by excluding other possibilities. It's a diagnosis of exclusion. And to make matters even more challenging, the primary and secondary types of fibromyalgia, or those who develop fibromyalgia for no known reason, that's primary, versus those whose fibromyalgia arises from a known condition, that's secondary. Because of these challenges, there is also no single treatment program to apply to all struggling fibromyalgia patients. One size does not fit all in terms of the treatment. So rather, studies often suggest that a multidisciplinary team approach of healthcare providers should be utilized to manage patients with FM. It's recommended that each FM patient have their needs be met and uniquely treated. So we'll look at some of these multimodal approaches to treating FM or team approach. For those less familiar with FM, many patients with this condition have symptoms that include things like fatigue, pain all over their body, sleep problems, mood symptoms, and chronic pain. They can also have conditions including irritable bowel syndrome, palpitations, thyroid dysfunction, adrenal dysfunction, gastroenterological symptoms, chronic headaches, and many other things too. Dealing with these and other fibromyalgia symptoms can have tremendous negative impact on one's quality of life and activities of daily living. So, like I said previously, the treatment of FM requires a comprehensive approach where the patient's individual symptoms are targeted, as there's no cookie cutter, one size fits all approach. It just does not work. So effective management approaches include things like chiropractic, allopathic acupuncture, soft tissue therapy, sleep hygiene counseling, nutritional counseling, mind-body therapy, and also dietary counseling like nutritional supplements that target specific deficiencies determined by lab tests, blood tests, and are based on that clinical history. So the treatment is centered on the human body's deficiencies, with the most important being the removal of any and all triggers that cause inflammation in the body. So uses of an anti-inflammatory herb like ginger, turmeric, boswellia, and other things like that can help until the causes are identified. And the gluten-free diet also helps a lot. It's very successful in reducing the autoimmune reaction that occurs with gluten sensitivity, which is estimated to be in as high as 80% of the population. So this is not to be confused with gluten intolerance or celiac disease, which is only 7 to 10% of the general population. And once the inflammation is controlled, weaning away of the anti-inflammatory supplements can be done successfully. The hormonal levels of the body must also be in balance with this condition, especially the thyroid, adrenal, and sex hormone levels. So lab tests should include a complete thyroid panel, like TSH, T3, T4, T7, free thyroxine, for example. Also a salivary cortisol test for adrenal function, sex hormone levels like DHEA, pregnenolone, progesterone, estradiol, and free and total testosterone. Assess and eliminate food sensitivities and allergies. Like I said before, gluten, dairy allergies are most common. And supplementation should include vitamins like omega-3s, multivitamin, vitamin D3, coenzyme Q10, minerals like calcium, potassium, magnesium, amino acids, and also sometimes others, like depending on the specific case that you're dealing with. And these keep our organs functioning well, like a finely tuned machine, basically. So don't overdose. And also if you're seeing a chiropractor, which you should for this condition, let them guide you in this process with all the supplementation and other things you should be doing. And at New Hope Chiropractic, we've had tremendous success helping people with FM. So if you have it or you know somebody who does, we'll be happy to do a complimentary consultation to see if chiropractic is a good fit for them. And also check out our website, newhopechiropractic.com, and hope you have a healthy day.